by my late husband, George Wolff, and his siblings, Alma and Robert Wolff, in memory of their parents, Nina and Sam Wolff. Sam was a past president of JFCS, and unfortunately, Nina suffered from dementia. In 2000, when our family was going through this, we didn't know where to turn. We were unprepared. We didn't know how to handle the deterioration. Therefore, in 2010, we partnered with JFCS to provide respite care, comprehensive assessments, caregiver support group, and self-care events like this one. That's our mission. Jewish Family and Children's Services is a nonprofit social service and mental health agency located in Teaneck and Wayne that provides mental health counseling, older adult assistance, food assistance, and basic need assistance to vulnerable individuals, seniors, and families in Bergen, Passaic, and Hudson County. Before I introduce our very exciting speaker, I'd like to go over a few items regarding our Zoom. Number one, this program will be recorded. Number two, we will be muting all participants during the presentation and during the question and answer period. Number three, please type your comments in the chat. The chat is located on the bottom of your screen. After Paula's remarks, we will pose questions and comments that you've written in the chat, and Paula will address them. I am thrilled to welcome back to JFCS Paula Span. Paula is a veteran journalist. She has been writing the new old age column for the New York Times since 2009. She also writes a column for the Times about grandparenting. She's the author of, Paula, I missed this part.
It's called When the Time Comes.
When the Time Comes. Families of aging parents share their struggle and solutions. Published in 2009, and an audiobook called The Bubby Diaries, released in Audible in 2021. Paula Span also helps prepare the next generation of journalists by teaching at the Columbia University Graduate School of Journalism. Thank you, and welcome Paula back. Paula, thank you.
Thanks, Eileen. I'm glad to be with this group, some of whom are New Jerseyans like us, some of whom are around the country, to talk about a subject that comes to all of us, almost all of us, sooner or later, caring for other people and caring for ourselves at the same time. I started thinking about this, and maybe you've experienced this, when I was in my 50s. I'm 73 now, but in my 50s is when this shift started to happen, and the same people that I'd been running into for years in my town, Montclair, New Jersey, at the farm market, at the school, at the supermarket, we used to talk about things like day camps and who was the best math teacher in middle school, and then college applications. And then all of a sudden, it was all about our parents, the hospital, rehab, assisted living. The whole conversation just changed. And most of us prepare like crazy to be parents. We read every book, we take every class, but we don't prepare much to be caregivers for our parents or our spouses or the other elders in our lives. And yet most of us will be caregivers. In fact, we may spend as many years or more caring for elders as we did for our young children. So let me pass along some numbers from the Centers for Disease Control. At age 65, the average American man can expect to live another 17 years, and the average woman another 20 years. And these numbers fell somewhat because of the pandemic, which took such a big toll on older people, but those numbers will likely rise again. So that is long life. And this group, by the way, is probably not average. I think it's safe to assume that this group is better educated and more affluent than the average American, and that correlates with life expectancy. And from what I'm seeing, it's mostly a white group, which sadly also predicts longer life. So survival at age 65 is only part of the picture, though, because older people live to be older still. So an 80-year-old woman can expect, on average, another 9 years. And a 90-year-old woman, 4 more years, and older men are not far behind. So we're routinely living into our 80s and our 90s to the extent that when somebody dies in their 60s, like, say, David Bowie, we're shocked. We say, oh, but he was so young. Longer life affects us in many ways, culturally, politically, economically, and it's a good thing, right? It's something to celebrate. Hooray. But it also means, among other things, that we are very likely to spend a chunk of our adult years as caregivers. You've probably heard that quote from Rosalind Carter, who has been living this, that everyone in the world either is a caregiver, has been a caregiver, will be a caregiver, will need a caregiver, or all of the above. And the statistics bear that out. So 2/3 of older people need help with long-term care, meaning they need assistance with what doctors and gerontologists call ADLs, activities of daily living, bathing, dressing, using the bathroom, hands-on care. And they need it for an average of 3 years. And that's why when I published that book in 2009, I called it When the Time Comes and not If the Time Comes. This book, by the way, is no longer in print and paper, but it is downloadable as an electronic book on any device. And in that book, I pointed out that families have always done this. We have always cared for our elders. What was that commandment? You know, honor thy father and mother. And our marriage vows promise in sickness and in health. So this is not really a new role, but it's a different role than if your grandparents lived with you when you were a kid. And that's why we call this column that I write for the New York Times, The New Old Age. How is caregiving different? Well, first, it's often a longer job because of these extended lifespans. So we may spend more years as caregivers. And it's a tougher job. If you've had an older relative come out of the hospital recently, you know, families are routinely asked to do things that registered nurses used to do. Hospitals release people sicker and quicker. And so you may be asked to change dressings on wounds or give injections or do home dialysis and things we are not trained to do, but they fall into our laps now. It's probably a good thing that more care is provided as outpatient these days, because hospitals are really not where you want older people to be if you can help it. But it does place more responsibility on the families. In fact, managing healthcare of older people in general is much more complex than it used to be. My grandparents and yours probably had a doctor. Who now has a doctor? Elders have cardiologists and neurologists and dermatologists and gastroenterologists and all kinds of ologists. They make many visits and appointments, maybe too many, and they take many prescription drugs, maybe too many, and there's not a lot of coordination between these specialists. You become the caregiver, the care coordinator, and caregiving is different also because many of us are working. Most caregivers work at least part-time, and because we are older ourselves. So it's not unusual at all for a 75-year-old to be caring for an 80-year-old spouse or a 95-year-old parent. Caregiving has changed also because longer lives means a higher number of people with dementia, which is so tied to long age. And caring for a person with dementia, as Eileen mentioned, that may be the hardest kind of caregiving of all. And yet, despite all those challenges, we still step up. Families still provide the overwhelming majority of care for older Americans, and primarily women step up. Spouses are the first line caregivers, mostly wives, because women are younger when they marry and they live longer. Then daughters and daughters-in-law. 2/3 of caregivers are women. That's the traditional female role. This is, among other things, a woman's issue. Possibly you have heard that phrase, caregiver burden. It can mean that the responsibilities on us cause depression, cause burnout, cause difficulties with our own physical health. It can be very hard work. During the early months of the pandemic, about half of family caregivers reported that their arrangements had been disrupted, and that made everything worse. But there's also something called caregiver gain. I don't want to be chirpy about this. This is not an advantage that we actually hope to have. But caregivers can develop a sense of mastery, a satisfaction with helping, a sense that even if nobody ever says thank you, and sometimes they don't, you did the best you could for the people that did the best they could for you, and that is meaningful. Our society relies on family caregivers when it comes to actually paying for help. For our seniors, we will pay collectively through Medicare for hospitals and doctors. We will pay for drugs, but we will not pay collectively for someone to help a senior take a shower, unless that person is so poor that he or she is eligible for Medicaid. So if caregivers had a theme song, and I sometimes wish that we did, I would suggest that 1961 number by the Shirelles, who I just learned came from Passaic, New Jersey. And there is a street in Passaic named for the Shirelles, but the song I have in mind is Baby, It's You. You know that song? Sha-la-la-la-la. When it comes to caregiving, baby, it's you. So how can we lessen the caregiver burden on the caregivers, and how can we increase the caregiver gain? That is what I came to talk about today. So here is one thing that helps. Expecting this, planning for it, talking about it. We need to shake off that anxiety and denial and talk to the people that we will probably be taking care of and the people who will probably be taking care of us. What do they want? Where do they want to be? What kinds of help can we put in place when the time comes? What will we want when it's our turn? And you also need that paperwork, the healthcare proxy, the power of attorney, which collectively are called advance directives. All of us should have these documents completed regardless of our age, because yes, we need them in a crisis, but the crisis doesn't have to be a stroke at an advanced age. The crisis could be you have a bicycle accident next week and you puncture a lung and you'll be fine, but temporarily you need someone to make medical decisions for you and talk to the doctors because temporarily you can't speak for yourself. So this paperwork is useful in a crisis, but it is also a way to start the conversation before there's a 911 call. And the fact that people of all ages need this paperwork means that it's a way to begin talking about it that is not apocalyptic. Because the conversation really needs to be a series of conversations over time to talk about caregiving, the way it will change, and eventually the way it ends, inevitably. However you proceed with your loved ones and yourself, let me just urge you, don't let this be unfinished business. These conversations are hard to have sometimes. People don't want to acknowledge that they are aging. They don't want to, we are aging. We don't want to acknowledge that we are declining, that we might need help, that we might become dependent. America is a country that prizes independence, and we feel a sense of shame when we can't do everything for ourselves, but virtually nobody goes through this life in that way. Because healthcare proxies and powers of attorney are advisable for all adults, they give you a way to ask some key questions. Mom, what do you want to do if you begin to have trouble making meals or getting to the supermarket or getting around to doctor's appointments? Where do you want to be? What kind of care is acceptable to you? No care is not an answer. How much medical care do you want if you become ill and you're in an ICU? And just as important, what don't you want? You want to stay at home? That's what almost everybody says, 90%. They want to age in place. Well, then we need to take some steps to make that possible. We need to have an occupational therapist come evaluate the house and show us where the grab bar should be in the shower. And we tell you that we have to take up these scatter rugs because they're a fall risk, and explain how we can rent a ramp if you're having trouble with the steps to the front door, or how to rent or buy a stair glide that will get you up the stairs. So first step, having the conversations. Next step, learning where to get help. A good place to start, available across the country, across the world, is with the Elder Care Locator. This is a service administered by the U.S. Administration on Aging, and it's on the web, Elder Care Locator. And for those who are not comfortable with online resources, there is an 800 number that we can maybe put in the chat, the Elder Care Locator, 800-677-1116. The Elder Care Locator gives resources in every part of the country for all kinds of home care, senior centers, transportation services, etc. Your local senior service agency is also a source of help in your county or your part of the state. In northern New Jersey, where we are, the Bergen County Division of Senior Services has a helpline that you can call. It operates senior centers, it delivers Meals on Wheels, it provides transit services, and it even has a chore program to help with minor house repairs at no cost. And of course, our host today, Jewish Family and Children's Services of Northern New Jersey, is on the case locally, providing kosher Meals on Wheels, a friendly visitor program, a weekly phone call program, caregiver support groups, which I'll talk about more later, and care managers to help seniors age in place. Some of these care managers work with low-income seniors through a county grant, and one works privately for clients who can pay out of pocket. So brief digression here, care managers. This is a fairly new profession, the geriatric care manager. I think a lot of people don't know about it, so I wanted to spread the word here. These folks changed their names a couple years ago, so the national organization is now called Aging Life Care Professionals. I still call them geriatric care managers. That's what they do. They are usually social workers, and they know your local services, so they can take over all kinds of jobs, from finding the people to help your parents go through the 40 years of stuff in their house so they can downsize, to arranging escorts to medical procedures and appointments, to troubleshooting claims with Medicare. They're especially useful if you live in a different state or a different part of the state from your loved one and you need local eyes and ears. So the pertinent website there is the Aging Life Care Association, and there's a locator on the site that helps you find care managers in your area. So I have used these professionals myself, and what I like about them is their independence. So if you hire them, they work for you. They do what you need. They don't work for the hospital. They don't work for an insurance company. They don't work for the assisted living facility. They do what you need, and they are expensive at about $200 an hour in our part of the world, but they can do a lot in an hour. And you may only need them for a certain period of transition, or there may be people in your family that can share the cost with you. At Jewish Family Services, they're a bargain, $125 an hour, but there's only one. So you may need to hire privately. But on the website, I found 17 care managers within a 10-mile radius of Teaneck, New Jersey, and more in New York City that serve this area, and they are all over the country. So if you are in that place where you think, geez, I wish I could clone myself, had that feeling, this is how you clone yourself. You and your family hire a geriatric care manager. I have used them with my late father and my late sister, and they were so worth the expense. My point here is there is help for family caregivers. It's not all in one place. And so the people that need the services don't necessarily know what's available. And it's not all free, but it does exist. And there may be more of it coming, God willing, because President Biden signed an executive order about 3 weeks ago to put major funding into both childcare and elder care. And I am cheering him on. Some other options that you might want to consider. Caregiving usually begins with any attempt to keep an older person in his or her home or apartment. That's been the mantra for elder care for many years, aging in place. Now, it has some obvious advantages, right? Home is familiar, especially useful for people who have cognitive problems. Life at home allows more independence. It's not routinized. You eat when you want to eat. You go out when you want to go out. And if you're in a home that's paid for, it may be much cheaper and more affordable than the alternatives. But let's be honest that there are disadvantages to aging in place, especially if, like a growing number of older people, you live alone. Because living at home alone can be isolating, especially if someone's no longer driving. And as we learned through the pandemic, but we knew it already, but we really got a dose of it, isolation for older people is not only, well, for everyone, but especially for older people, it's not only unpleasant, it's actively dangerous. It leads to depression and anxiety. It is associated with declines in physical health. It can be unsafe if an older person is having trouble climbing into a bathtub or climbing stairs, but it's where we usually start. So how can we keep people at home as long as possible? Well, Bergen and Passaic counties are lucky to have a local nonprofit organization that's part of the Village movement. The Village movement started in Boston about 20 years ago to help people age in place. The first one was called Beacon Hill Village. The one in North Jersey is called North Jersey Villages, and its motto is aging at home, but not alone. Now, there are more than 250 of these villages now across the country, with dozens more being formed, and you can find them online through the Village to Village Network. Village to Village Network tells you where they are. These villages, they generally connect seniors who live in a particular town or a particular region. Sometimes it's even in a big apartment building, and the people who join the village pay a fee. It's usually a couple of $100s a year, but there are discounts for people with low income. And then they hire a coordinator, and the coordinator works out of an office and works with local businesses and works with local service providers and usually with volunteers. And when you join, in exchange, you get referrals to services that have been vetted, everyone from plumbers and bill paying services to home care aides, sometimes at a discount. Volunteers help with driving or small household repairs. And perhaps most important, the members of the village have each other. So they have a community for potluck dinners or bridge games or field trips or discussion groups. And it's a useful thing to help extend the number of years when you can safely live in your home Let me also tell you about, I think, what is one of the better kept secrets in elder care, though you may know about it, adult day programs. Adult day programs allow people to continue to live at home, but not have to spend long days alone in front of the television while their families worry about, are they eating? Are they eating healthfully? Are they taking their medications? Are they lonely? Are they understimulated? So if we are in a situation where your elder can stay in home, but shouldn't be there alone all the time, adult day programs provide transportation. They take you to the center. There are hot meals. There are activities from art to exercise to discussion group. They foster friendship. Usually there's a nurse on the premises to monitor participants' health, to distribute medications. Some programs, including one at the JCC in Tenafly, our host, are tailored for people specifically with dementia. Some of these programs are set up to help people take showers and get their hair and nails done, which is a kind of a boost for mood. So adult day costs less than any other kind of elder care. It lets the caregiver hold on to a job or just take a break, a few hours in the day or a few days in the week when you can not be responsible. You can go have coffee with your friends. You could go to exercise class. You can sit and stare at the wall if that's what's going to be helpful to you on a particular day. So local folks, Bergen and Passaic, have many day centers. And so if your elder is able to stay at home, but you are working or you have a family of your own and you can only be there on weekends and you don't want this person to be alone day after day, this is a good solution, at least for a while. Let's keep in mind that all elder care solutions tend to be temporary because health changes, mobility and cognition keep changing and usually declining, and caregivers have to keep adapting. So if you have reached the point beyond adult day, beyond using a senior center, the next step usually is you're looking at home care. Most people start with home care agencies. And in this area in North Jersey, they charge about $30 an hour. It's less in other parts of the country. But what nobody tells you ahead of time is nobody pays for this except baby, it's you. Medicare does not cover home care except briefly after hospitalization. Medicaid will cover home care if your elder is low income enough to qualify. But even for people that do qualify, there are often waiting lists and limits on how many hours of home care people can receive. So nevertheless, if what your elder really needs is someone to come in a few times a week for 3 or 4 hours, and many home care agencies will not come for less than a 4-hour block, then this could be the next place that you turn. Home care aides can help with the bathing and the dressing. In some cases, they can do driving, take people to appointments, they can prepare meals, they can do laundry and housekeeping, and ideally, they are a friendly presence. They're companions. They get to know their clients, and they can sit and watch Family Feud with them. So let me point out, though, that one reason there is enormous turnover among home care aides is that it is a demanding job and it is a poorly paid job. So if you are paying $30 an hour, the aide is taking home roughly half of that. And the agency that provided her, usually it's her, takes the rest. She likely has no benefits. She may qualify for food stamps and housing subsidies herself. Many direct care workers do. It is not a high income job. And it's a hard job. So if you have access through personal connections, through a church, a synagogue, a mosque, a neighborhood listserv, to an independent caregiver who does not work for an agency, I would consider that option. These independent workers may stick around longer. Now, there are disadvantages. If she gets sick or her car won't start, you're stuck. Agencies supposedly will send a substitute if your caregiver can't get to you. And agencies do background checks and sometimes drug tests. And they will tell you scary stories about what a terrible risk you are taking if you don't go through an agency. Plus, not all of us want to be employers and pay taxes and workers' compensation and deal with the paperwork. But not everyone who works for an agency will do a great job either, and turnover is a real problem. So if your neighbor or friend knows of caregivers that they have used themselves for years and those people are available, I would be open to that possibility. You can arrange for background checks yourself. You can arrange drug testing yourself if you want to. And if you pay a private caregiver yourself and you pay, let's say, $20 an hour, she's getting a raise over what an agency would pay, and you're getting a discount. It's not a bad prospect. When home care is not working anymore, if people are growing more frail or more forgetful and they need more attention, or the cost of home care is getting prohibitive because you need so many hours of it, and the isolation issue might still be there. Some people are in a position to have a parent or an older relative join their own households. If your house is physically well set up for an older person, if someone is home most of the day, that could work. Or in some cases, we've all heard of caregivers who move into the elder's home. We've also heard people say, one of us will kill the other within 2 months. So assisted living might be the next step. Assisted living facilities often portray themselves as somebody's last home, final home, the last place that they will live, and it's generally not true, because the average stay in assisted living is about 2 years. Of course, some people live there much longer. But the reason is that assisted living is set up to provide meals and activities and socialization, and its staff can help with those ADLs, bathing and dressing. And these places look pleasant when we go visit them, kind of like an upscale Holiday Inn, rather than the hospital feel that traditional nursing homes have, the long corridors, the linoleum floors. Residents have apartments of their own. They don't have to share for the first time in their lives since they went to college. They don't have to have a roommate, and they can bring their own furniture and belongings, and that's comforting. But these are not really healthcare facilities. They may provide medication management. So your mother, you will know that she is taking her diabetes medication, but they're not set up to test her blood sugar 3 or 4 times a day. They may have a nurse on call or on the premises, but not at night and not on weekends. If your dad develops a fever or he has a fall, assisted living facilities will not treat him, and they often will not even assess him. They will call 911 and send him to the emergency room. Also, assisted living is expensive and you pay it yourself, but it can work well, especially for a gregarious person who likes concerts and chatting with people and playing cards, who can't handle all of the work of maintaining a household anymore, but isn't very ill, or maybe has some memory loss, but can still get herself to and from the dining room and to and from the class in painting, and can enjoy a movie with friends. So people can thrive there. It was a good option for my own sister, for instance, who was physically disabled and living alone. This was really a good place for her and where she wanted to be. When people leave assisted living, it's not usually because they die. It's because they've declined and the facility says, we can't meet your needs any longer. Then it's time for a nursing home. Nursing homes are often not as awful as people assume. There are good nursing homes. And looking on the website medicare.gov, you will find this feature called Nursing Home Compare, that lets you look at all the nursing homes in your area and how they're rated and what the federal inspections show. So that can help you select a nursing home. Nursing Home Compare on Medicare.gov. In fact, on Medicare.gov, you'll find ratings and rankings for all kinds of senior services, including hospices and home care agencies. But also a geriatric care manager, if you hire one, can help you find assisted living or a nursing home because they know the facilities in your local area. But these nursing homes are not really the old folks' homes that we might remember from childhood. Those folks are now in assisted living, and nursing homes are for people with serious health problems or moderate to severe dementia who need round-the-clock care. Now, some are focused on short-term rehab after a hospitalization, but some are still the places where people live out their days. And they are the only real financial safety net for elder care. When your parent has spent down her assets and she qualifies for Medicaid, Medicaid will pay for nursing homes. Medicaid will pay occasionally for assisted living in some areas, like in New Jersey, there are some Medicaid beds for assisted living, but they will pay for nursing home care. This feeling that people have about placing an elder in a nursing home that they or in assisted living, but especially in nursing home, is that they have abandoned their elders, and it can bring tremendous guilt. But the reality is that all of these places, including home care agencies, including assisted living and nursing home, all of them are understaffed, even the good ones. And the pandemic made it all worse. There was an exodus of staff from all of these places. So you will find yourself a frequent visitor to the nursing home or the assisted living. You will be troubleshooting, you will be noticing what's not getting done, you'll be meeting with administrators, maybe you'll be doing the laundry, or you'll be sending a geriatric care manager to do that because your elder's in Florida and you're in Teaneck. Caregiving doesn't stop even when somebody leaves home. Finally, I'd like to talk a little about end-of-life care. Sometimes we hear people say that caring for an elderly parent is a role reversal. You become the parent. I understand that feeling, but it's not a good analogy because older adults are not children. We make our own decisions unless we have severe mental cognition problems. We make our decisions, and even if they're not the decisions that you hope we'd make, we still get to decide. And it's not a good analogy because children, if we're lucky, move towards independence, and elders move towards greater dependence, or perhaps we should say interdependence, because we're all interdependent at various points in our lives. But towards the end of life, when people develop a condition that will not get better, and they want to die at home, which is what most people say they want, that's when the conversation has to shift. And there are lots of programs to help us do this. Online, you will find the Conversation Project. The Conversation Project. It's a nonprofit started by Ellen Goodman, who's the long-term columnist for the Boston Globe. There is also a site called Prepare for Your Care. Prepare for Your Care. It's developed by the University of California at San Francisco. You may also have seen the 5 Wishes document. We should all have these discussions for our own sake and our children's sake. Picture being in an ICU and a stranger in a white coat is saying, does your father have a DNR? Would he agree to a feeding tube? Would he want to be on a ventilator? And you don't know, because nobody ever wanted to talk about that. That is a huge burden on the ones we love. Let's not do that to them. Let's not let them do that to us. And in case of serious illness, in addition to healthcare proxies and powers of attorney, advance directives, you also want a form called POLST, P-O-L-S-T. It stands for Physician Orders for Life-Sustaining Treatment. It's in every state. In some states, confusingly, it's called MOLST, Medical Orders for Life-Sustaining Treatment, or MOST. It is a form that you and the doctor or nurse practitioner fill out together, and it spells out in more specific terms what you want and what you don't want. It clarifies your so-called goals of care. A DNR only covers resuscitation. A PULSE will tell everybody from the EMTs to the emergency room staff whether you want a feeding tube or IV hydration, or whether you want comfort care only or some blend of the two. And if we are talking about comfort care at the end of life, then we're talking about hospice, which has been a Medicare covered benefit since 1983, and about half of all US deaths now occur in hospice care. Hospice is a service. It's not usually a place. It sends nurses and aides and social workers and a non-denominational chaplain, if you want one, to your elder in his home or the place that he calls home, which can include assisted living or a nursing home. It doesn't provide 24-hour care. It provides a 24-hour phone line to get help in emergencies or when you just need advice. But a family member needs to be there in the home or hired help, or in a facility, the staff is there. But hospice is the specialist in end-of-life care, the ones who know what to do, the ones who can supply what you need, the equipment, the drugs, the training. They're the ones you call at 3 a.m. As staffers will tell you, people often wait too long to call hospice. They might call when death is only a few days away. And so then the families and the patient miss out on all of the support and help they could have had for weeks to help them through this passage, including bereavement services. Hospice doesn't mean giving up hope. It means you change what you're hoping for, from cure to comfort, support, familiar surroundings, familiar friends. My mother and my sister both benefited enormously from hospice care. I have become a believer over time. Nothing makes this process easy, but you don't have to go through it by yourself. And I have heard infuriating stories about doctors who just blow off family concerns. Should we be thinking about hospice? Oh, no, we're not there yet. No, if you're thinking about it, you are there. And if you are not getting a serious response that you trust from a doctor, I would call a different doctor or just call hospice yourself. You don't need anybody's permission. Just please don't wait. And finally, I just want to talk about you, us, but now you. I've dispensed my duties as an elder care provider. I don't have elders left. I am the elder. But you, the family caregiver or the future family caregiver, you may not even think of yourself as a caregiver if you're at the point where, no, I'm just dropping off the groceries twice a week and taking them to the doctor's appointments. I'm just filling the pill pack. I'm not really a caregiver. Oh, yes, you are. You are providing essential services, and you may be facing a lot of stress. Making decisions on someone else's behalf is stressful. Watching someone that you love struggle and wondering whether and how much to intervene is stressful. Finding care is stressful, especially now with labor shortages throughout the healthcare system. Paying for it is very stressful. And when we undertake this role, we don't know how long it will last. We don't know what will be demanded of us. We just know that we are needed. And there will be times when we just wish that someone else could take over for a while, but often there is no one else because maybe it's you. So this is our current system, and it evolved without anybody thinking very much about it as a system. It depends very heavily on family, almost entirely on family. As people's lives grow longer and longer and the work gets harder and harder, we haven't figured out what to do for people who don't have a family. We probably shouldn't even call this a system, because system sounds organized and logical, and it's not. So we need to reinvent it, but we are probably not going to reinvent it in the next 10 years. We are probably not going to get a rational, effective, long-term care policy that lifts the financial burdens and the other burdens from family shoulders within the next decade. And meanwhile, baby, it's us. So let me urge you to do the things that you can to care for yourself too when you are in this situation, to take a break, to look into respite care. Some assisted living facilities will offer this. Some home care agencies will offer this. Sometimes there's a family member in Montana that can only come once a year, but that person comes and you go away. Sometimes it just comes down to having coffee with a friend, taking a walk, going to that yoga class and not feeling guilty about it. And in particular, finding a caregiver support group. I know this sounds like one more thing to try to do, and who has the time? But remember that airplane analogy. You have to put the oxygen mask over your own face first, over your own nose and mouth before you try to help other people. If you are involved in heavy-duty caregiving, you need a place where others are going through the same thing. It's a place to share dilemmas and advice. It's a place where you can say the unthinkable because it is not unthinkable. Other people have had the same thoughts. They will understand what you mean. There has been a lot of research on caregiver support groups over the years, and it shows that caregiver support groups help improve your own mental and physical well-being, and that matters. Many kinds of organizations offer caregiver support groups, including our host, the Jewish Family and Children's Services of Northern New Jersey, but also lots of other places. Hospice bereavement groups, churches, hospitals. This will be on the elder care locator or by asking around in your local community. If you can manage it and you need it, an individual therapist can also be a great support and help. And I hope we have gotten past any shame or stigma attached to psychotherapy, because caregiving is not only physically exhausting, but it can be emotionally complicated. Some of the people that we are caring for are not grateful for our help, and we could help ourselves in navigating this. So a therapist, if you can do it, this also constitutes putting the oxygen mask over your own nose and mouth before you try to help other people. People will rarely say thank you for the work that you undertake as a caregiver. And sometimes the person that you are working so hard to take care of is the last person to say thank you. So let me say it now. The entire elder care system in this country, if we even want to call it a system, would collapse without family caregivers. You are essential, you are undervalued, you are overworked, and you keep going anyway. So thank you for what you do now and in the years ahead. And thank you for listening to me talking for so long on your screen. The folks here have been collecting comments and questions in the chat, and I see that there are some. So I'm going to turn it over to Linda Michelle and say, what do other people want to say besides me? Thanks.
So thank you so much, Paula. So somebody was asking about hospice care, that they have a friend who's in hospice and is very concerned that hospice will end her life earlier than she intended because they want to give her morphine, and did anyone have that experience? Somebody else had answered, but if you could answer that as well.
Yeah. There are so many misconceptions about hospice. It's been around for 40 years and it's no longer, but it's been a Medicare benefit for 40 years. No, hospice does not hasten the end of life. Sometimes people wish it would, but that's not its mission. Its mission is to keep you comfortable and support your family, who's taking care of you. So they will not give you morphine unless you want morphine. They will change your drugs if that's what you want. They will take care of you where you are. You do not give up your right to accept or reject any medical treatment. I mean, you transition from wanting care, but no, people on hospice receive drugs as they need it for pain relief or to reduce agitation. They can always say no, and the family also is involved. So you do not become some kind of passive victim if you're a hospice patient. It's the opposite, really. Yeah, you get a lot more self-determination because usually you're at home, or the place that you call home, and you are not on that medical conveyor belt of, let's do one more test, let's try another drug. Like you have said, I understand, I accept that my life is ending. I want to be at home with my family. Here's the people that can help me do that. I can say no to anything they propose. I can leave hospice care and re-enroll later. So I think that's a misconception.
Great. And then, just a reminder, everyone could put their questions in the chat box. But here was another one. What is the best way to prepare ourselves psychologically to be cared for in such an intimate way?
Yeah, that's a tough one, because we have been taking care of our physical needs for our entire adult lifetime. And so the idea that someone's going to be there when we take a shower, that someone's going to be there when we use the toilet, that we might need help being fed, it's very difficult. And I don't have an easy answer except to remember that there were times when we did this for our family. There were times earlier in our lives when we helped other people take showers and baths, and when we helped them get dressed and we helped feed them. And it is not a shame, should not be a sense of shame for us now. But that is easier said than done. So I understand that it's difficult, and family caregivers who are providing the help need to understand that too. This is not an easy relationship. To be able to accept help is sometimes as hard as giving help. But I think it's useful if we can talk about it, and if we could say, I know you'd rather do this yourself, but there were times when you did this for me. If we have the means, we could hire. Sometimes it's easier to hire a stranger to do these intimate tasks than to allow your family to do it. And if you have the means and the person agrees, then that's an option. If you don't like that I'm here in the bathroom with you, would you rather that we hire somebody? We have the ability to do that. Or would you rather move into a facility where people can help you with that and it's not me? So again, these are very individual decisions. I think discussions are good. I understand people don't often want to have the discussions, but this is a real rubber meets the road moment. When someone is helping you put on your clothes after a shower, that is a very intimate moment. It's hard for everybody. I think it's a good time to say, are you okay with this? I understand it's hard. Let's keep working at it. And if you don't like it, would you rather that someone else help you besides me? And how could we arrange that?
So this is a good to go back. Somebody asked earlier, if you can't do it yourself, is there a once-a-year tax accountant which would be able to be experienced in preparing the paperwork required to pay for a home health aid worker? So I guess just anything about how, like you mentioned about having to pay taxes for them and the drugs.
Well, I mean, there is information on like, and hiring anybody, not just a home care worker. If you hire a nanny or you hire someone to clean your home, you are supposed to be paying workers' compensation and taxes for that person. A lot of people never do, but there's information. The IRS will give you information about that. But there are also these specialists called elder attorneys, and they deal with wills and estates, but they also can help you do a power of attorney, a healthcare proxy, and they would have information on how you have to legally hire help, because then you can also get a tax break. So if you don't want to go online and do it, or you're a geriatric care manager or an elder attorney, and they're all over the country, they can help you do the paperwork also.
And then there was another question, which was relevant. How do you suggest starting the conversation with the care receiver, especially when they don't want to talk about it?
Yeah, who wants to talk about it? Like, we'd all like just to pretend that it's not happening. So, I mean, I think one advantage of the paperwork is that it kind of forces you to talk about it. So, I mean, you could say, I said to my mom and dad, who were not averse to talking about this, so I was lucky, but I could say that my then husband and I were filling out our own powers of attorney and healthcare proxy because we had a child, and anybody needs this, because you could need somebody to make medical decisions for you when you're in your 40s or your 50s. So we could say, we're doing this, let's you and I do this too. But the paperwork itself kind of forces a conversation, because it says, look, what are the conditions under which you might need somebody to make decisions for you? And you can personalize them. So, and who in the family is best able to deal with doctors, maybe who in the family is best able to deal with finances. And I think also these Prepare for Your Care, the Prepare for Your Care site at University of California, San Francisco, the Conversation Project, there are all these online resources that kind of set up different scripts that you can use and ways that you can ask the question. Because it's very easy. Sometimes it's the younger people that don't want to talk about this and the older people that do. The ones that say, no, you're fine. You're going to be going to yoga classes for the next 20 years. Well, maybe. Great. But what if not? So starting it, I think, is the hardest part. But it's not a one-time conversation. We have to kind of go over it several times. The denial factor is very high. Sometimes you don't make much progress and you say, okay, we'll talk about this next week, but I'm not going to forget about this, because you, the elder, are doing your caregivers, whether they're your children, your spouse, your friends, your cousin, you are doing us a tremendous favor by making us aware of your wishes and preferences. And if we don't have this conversation, you are forcing us to guess. You're forcing us to be shooting in the dark. We don't know what you want. And as caregivers and legally, as people who are your proxies and have your power of attorney, what we are supposed to be doing is not making decisions that we want for you. We are supposed to be making decisions that you want. We are supposed to be following your guidance and telling the doctors what you want. We are not supposed to be substituting our judgment. We're supposed to be making it possible for you to make your judgment, even when you can't speak for yourself. So how can we do that if we don't know what your judgment is? And it might take us a while to figure this out. Here's where I think caregiver support groups can be helpful. Here's where maybe even family therapists can be helpful. Some geriatric care managers are licensed clinical social workers, and therefore they can have these family discussions as therapists to help families reach some agreement about where are we, what do we want to happen, what do we not want to happen, because we can't fulfill your wishes if we don't know what your wishes are and if you haven't given it some thought and communicated that to us.
Okay, great, thank you.
Can I just add something, Michelle?
Sure.
So when we're talking about these, medical decisions, if somebody's incapacitated, even temporarily, we put a lot of emphasis on the written documents. What does the power of attorney say? What does the healthcare proxy say? If someone's in an emergency room, these doctors are not going to be flipping through your 6-page document to see what does it say. They're going to be turning to whatever family member is there, whoever's closest or whoever they can get on the phone, and saying, what do you want us to do? So it's another reason to know what your parents or your elder wants and to be able to say it. And it also means that sometimes the person that you appoint to be your proxy isn't always the one that you're the closest to or the one that's geographically closest. It's sometimes the one that can be the most hard-ass in an emergency room and say, no, don't do that. And that was me. I was that for my dad. And I had to say to some nice young doctor, no, you need to understand, we are prepared to lose him right now rather than go through these things you're suggesting. No. And once you say that, they actually are kind of relieved and say, oh, okay, they know what they want. They understand that immortality is not one of our options here. So it's a reason to really give careful thought to this. Sorry, go ahead.
No, I see that people are starting to drop off. So I kind of was thinking, the only other question I was going to ask was about, someone said about driving, but I don't know if people, are ready to go and they want to wrap up, and they could email us and be in touch with JFCS or with the JCC for any of these questions. Or if they want to hear a little
I just
bit more.
want to add that, and thank you so much. This was really amazing and very informative. But I do want to say that Jewish Family and Children's Services, our local one, and really the many agencies across the country that are either a Jewish family service or a Jewish family and children's service, we are staffed with social workers who can also help you with these questions. Even if what you need is not exactly what we have on our website or the programs and services that we provide today, we are always available to speak with you, to speak with a caregiver, an adult child, a spouse, any caregiver who has any of these many questions. And we may not be the perfect ones to be helpful, but we will certainly hook you up with somebody who will be. And so know that we're available always should you have other questions. And I know that we'll be sending out a lot of material about what we provide. And also, of course, the JCC on the Palisades, which is co-hosting this event, has many programs and services for seniors. So just know that you're never alone.
Okay, thank you, Susan. So
Yeah, I'm
thank you.
sorry we didn't get to answer about siblings
Yeah.
differences, but right.
So thank you, Paula, for the very informative program. And thank you all for attending our Wolff Caregiver program as part of our But Who Takes Care of You series. We look forward to seeing you at future programs. And like Susan said, the information we're going to send you will include a link to the recording of this event, a link to the JCC and their wonderful programs, a link to JFCS, including our caregiver support group, our respite care for caregivers, our private care management, individual therapy, and more. So please don't hesitate to contact us. Paula will also send us a link, which we will send to you with her website. So you'll have a wealth of information. Like Susan said, don't hesitate to reach out. And again, we're so glad that you were able to join us, and have a wonderful rest of the day.
Thanks.